I'm Mike Davis from Bridge Biotec, and we are developing safe peptide medicines to treat serious inflammatory diseases. This is just a bit of an overview of what we've done since we started. The IP we're building, and it's going really well. A bit of seed investment has enabled us to do the studies I'll give you some details of, and we're now looking for a bit more seed investment, an initial 250,000 UK pounds, that's about 300,000 US dollars, so that we can remanufacture the peptides, reformulate the peptides, get the lab set up again, and provide a platform, as we see, for further investment, and then progress that formulation to what we call an ex vivo proof of concept that it works in human inflammatory tissue. The plan for exit could be at any stage, I see, once we've proved this works in human tissue, but any stage I'll show you later on. Here it says 5 to 6 years clinical proof of concept. A bit about inflammatory diseases. Inflammatory diseases are the biggest human disease condition. Everybody in this room will have had an inflammatory disease at some stage in your life. Probably a lot when you were younger, and probably will a lot more as we all get older. The current therapies for inflammatory diseases are not perfect. Yes, they help, but GI, gastrointestinal upset, liver failure, kidney failure. Take too many aspirins and it will kill your kidneys. Too many paracetamols, 16, you'll need a liver transplant. So, these are not safe medicines. They do work. That's why many companies across the world are seeking safe or safer and anti-inflammatory medicines. And this is where Bridge wins, as I see it, because what we have are peptides, small proteins, and that means those proteins will be broken down into their constituent amino acids. A little bit about the markets. The markets, inflammatory bowel disease, well-known market, $9.6 billion and growing. Current treatments, first line, are not great, the 5 ASAs. And then they get into the toxic ones that do have efficacy, methotrexate, known liver failure. Our initial target is mild to moderate, which is 85% of whether 85% of the current cost is. Atopic dermatitis, very common. 20% of kids get atopic dermatitis. The lead treatment for atopic dermatitis is an emollient. That's not even got a medicine in it. The second line treatments, the steroids, well, they're second line because they're toxic. Steroids are absorbed, causing problems with systemic overexposure. And of course, the third line, the calcineurin inhibitors, are anti-cancer drugs. Mothers don't like putting anti-cancer drugs on babies' faces. Burns, rheumatoid arthritis, chronic obstructive pulmonary disease, there are many areas that this could go into. Little bit about peptides. Well, peptides are small proteins. They're classically less than 50 amino acids. We have 5, and ours are between 8 and 18 amino acids. So if you want to be absolutely spot on, they are oligopeptides. We've demonstrated that they switch off inflammation. We can show here the pink is delivery into human cells. Here we've demonstrated at doses of nothing, same as placebo, 10 and 100 nanograms per mil, we can switch off inflammation. This is a well-recognized cellular model. And in this, we demonstrate that not only do they switch off inflammation, they also prevent the activation of inflammation. This is key because, as you know, these inflammatory diseases are cyclical. They come and go. If you start treating in the flare, with our safe compounds, you'll be able to continue treating and potentially prevent the reactivation of the disease. I've said they're broken down into amino acids. They will not get to the liver. They are highly selective. We're in tiny doses. And the nanoparticle is essential to deliver these peptides into cells. Investment, we're looking for 250,000 UK pounds. That's about 300,000 US dollars. Of course, that changes every day at the moment. Manufacture the peptides, initial formulation, laboratory setup. Also, it provides a platform, as I see, for crowdfunding, grant funding, further investment of 450,000. That's a total of 750,000 UK pounds to deliver the ex vivo proof of concept. These compounds work in human tissue. This will be achieved by equity and bridge, of course. It opens the door. Once we've shown this works in human tissue, it demonstrates that we could enter this multi-billion-dollar market of inflammatory diseases. For the UK, we are SEIS and EIS approved, and of course we're looking for people with smart money, some people that will bring more to bridge. This is the plan right the way through to clinical proof of concept. The first year, this is in US dollars, the first year is this 700,000 UK pounds, million US dollars, will give us proof that this works in human tissue. There are many people, companies who are interested in that knowledge. It works in human tissue. 8.5 million is the preclinical development right the way through to approved IND CTA. As part of that 8.5 million, we will gain approval for our proposed adaptive clinical development plan. That's a worldwide approval mechanism that will speed up the clinical development when we get to that. 6.5 million, that's the money to actually acquire the peptides. A bit about us, management team. There's me, I'm the founder and CEO of Bridge Biotec. I have patents, we have legal, and we have financial. John McLaughlin is our consultant. He is the consultant, the head of inflammation and tissue repair at Manchester University, and he fully supports this area in inflammatory bowel disease. He's a GI surgeon by background. Summary. We're looking for 250,000 UK pounds, what I term as smart money, now. That will allow the peptides to be manufactured, formulate, and get everything set up. This will achieve, we see, around about 10% equity. There's always open to negotiation, and it will form a platform. This will be followed on by 450,000 UK pounds, 600,000 US dollars, to prove that these novel peptides work in human tissue. And with that, select the lead indication, the lead formulation, and of course further equity for the investor. It'll get us to the important next stage of development. We know these compounds work in the human inflammatory condition, and it potentially, as I said, opens up the multi-billion-dollar inflammatory market. And that's about it. Thank you.